Thank you for viewing this short PowerPoint lesson. Healthcare reform writer and speaker Dave Racer is going to explain a simple but powerful strategy that could save your small group coverage, and in so doing, save you thousands of dollars in insurance premium. Here's Dave Racer.
This is the problem that all small groups are facing. If you took advantage of early enrollment in 2013 to avoid huge rate increases, you possibly face a 30 to 40 or even 50% premium increase this fall. But you, along with hundreds of other employers, can use this strategy to keep your current plan and save money. The Affordable Care Act forces small groups into plans that are community rated. I'll explain that in a minute, but there is an exception. Let me give you a quick review of what community rating means for small group. Under the old law, your health insurance premiums were determined by an experience rating based on the health of your group. There was a 67% rate differential allowed between the healthiest groups and those with many health problems. So if you had a healthy group and you paid $100 in premium, the unhealthy group, the most they could pay differently from that was $167. But each year, the law limited the rate increases to 15% for experience. In this way, the rate increases on a healthy group that suddenly had a large claim was controlled. Community rating, however, is required under the new law. Under the Affordable Care Act, all groups will now pay the same rate for the same plan, despite whether you are a healthy group or an unhealthy group. And this especially punishes the small, healthy groups, and they are the groups that now face huge rate increases. So the key issue facing employers with healthy groups now is these massive rate increases that you face coming up this fall when you're ready to renew. As much as 30 to 42% or even more are being discovered by agents at this time. And this will make group insurance unaffordable for many employers, and many employers, maybe even you, would drop your insurance. So this means that just around Thanksgiving or Christmas, you're going to be telling your employees that their families risk losing their health insurance. This is not good, especially when there's an alternative. Now, last November 2013, President Obama made an announcement, and he repeated it in March of 2014. And the announcement was this: you can keep your current insurance plan, and this included small groups, to 2017 if the governor of your state applies for the waiver. Wisconsin and North Dakota governors did this, and in fact, dozens more did it across the country to protect their small groups from these huge rate increases. So Wisconsin and North Dakota employers have the right to choose an ACA compliant plan with community rating or a non-ACA compliant plan without community rating. So if you're an unhealthy group, you may want to choose the ACA compliant plan. It could hold down your cost. But if you're a healthy group, you don't want to do that. You want to choose a plan without community rating, and the difference in cost and quality is huge. The strategy is really rather simple, and that's to change the governor's mind. And you say, nobody can do that. Well, we're going to show you how. Governor Dayton, to this date, has not allowed Minnesota employers this option. Apparently, Governor Dayton doesn't understand the unaffordability of small group insurance as you do. Governor Dayton may not know that he can simply change this with a stroke of his pen. So we have to change his mind. And here's how we're going to do it. Use this series of letters. Your agent can walk you through this. We provided 4 sample letters on a website accessible to your agent. One of them is an employer letter to Governor Dayton. The second letter is from the employer to Commissioner Michael Rothman, the Commissioner of the Department of Commerce. And we have parallel letters for employees to send to Governor Dayton and to Commissioner Rothman. Let me share just a sample of the letter from employers to Governor Dayton. The letter would go like this. Our company is in the business of, let's say, manufacturing. We employ 32 full-time employees and 7 part-time employees. Like other businesses, our goal is to grow and prosper in Minnesota. We are, however, increasingly concerned about how the Affordable Care Act threatens our profitability and our ability to grow new jobs in Minnesota. We need you to intercede with Commerce Commissioner Michael Rothman to give us some relief for 2015 and 2016. Specifically, my employees and I are very concerned about our 2014 health insurance renewal. We've already heard that many small groups face premium increases of 30, 40, or even 60%. And then later on in the letter, we say, we will be having group meetings with our employees in which they will be told our state government had the authority to prevent this. You were asked to help us but decided it was not worth it for you to fix it. Or should we just tell them you did not care enough to change it? And we conclude the letter with, please let my employees and I know you are going to help us or not. Now this may seem like a sharp letter, but sharp letters are what gets the attention of elected officials. So we need to change the governor's mind, and this strategy requires employers to write to the governor and the Commerce Commissioner. Many employers have already done this, so you are not alone in carrying out this strategy. When you do the letters, provide your agent with copies of the letters. Those need to be accumulated for a media campaign that the agents are going to promote to make sure the strategy sticks. Now, if you're wondering if letters really work, you have to know that anytime a legislator gets one letter from someone, they find it interesting. When they get 5, they consider it an avalanche. When they get hundreds and thousands of letters, it brings tremendous pressure on the elected officials. The message of your letters will be combined with a media strategy, so we're not just relying on the letters themselves. There will be a media strategy put in place to make sure that the public hears this. Remember, it's an election year, and Governor Dayton wants to win re-election. This is the best time and the best way to get his attention. It sounds simple, and it is simple, but it's powerful. So consult with your agent who can walk you through this strategy now. And we hope that you will join with the hundreds of other businesses who are carrying out this strategy to save themselves money and to save their group coverage. Thank you very much.
Thanks, Dave. Your insurance agent can provide you with all the details, including sample copies of the letters. Give your agent a call today. And thank you for viewing this message.